Did you tear your ACL and you're going to have surgery and you're deciding between grafts? You're deciding between an autograft and an allograft. So we're going to go over in this video why an allograft is actually not a bad thing. And I know a lot of people get hate on an allograft or people talk down on it, but we're going to give you guys the pros and cons of using an allograft for ACL reconstruction. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. So let's just jump into it. So if you tore your ACL and you're going to have ACL surgery, specifically ACL reconstruction surgery, they need to replace that ligament. So you can't use that previous ligament that you had because it's already torn. So in order to replace that ligament, you need to choose a graft. And we go over the different graft choices in the video in our description below, but I'll give you a quick rundown. So the two main categories are autografts, meaning you grab a tendon from your own body to replace that ligament, or you use an allograft, a cadaver, a dead body. For this video specifically, we're going to go over allografts because a lot of people have negative connotations for an allograft, but we're going to give you guys a breakdown of the allografts because you'll be surprised at the end of this video and it might make you rethink your decision of choosing an autograft over an allograft specific to your needs. So the pros, the first one is you don't have that morbid site pain. So meaning when you use an autograft, you have to grab a hamstring or you have to grab a patellar tendon and part of your bone or a quad tendon. So they need to harvest that. And when they harvest that, you're gonna have that pain in that incision. So you have more pain than usual, especially for the patellar tendon. Because it's a cadaver, you don't have that. So you don't have to go through that additional procedure and it's less painful after surgery. All right, guys, another pro of an allograft is that you don't have that additional quad or hamstring weakness. The reason is that if you choose a quad tendon or a patellar tendon, you'll see that your quad is harder to activate after surgery and you lose quicker muscle. Same thing goes with the hamstring. You lose more strength in the hamstring because it's harder to activate because it hurts. And that is one thing that you don't have with an allograft because they don't grab that there. So you'll have it easier ability to activate your quad and hamstring after surgery. All right, guys, another pro for an allograft is that because you don't have that harvest site pain and you don't have as much weakness in your quads or hamstrings due to not using that tendon graft, it allows us to have a quicker, earlier recovery time. Meaning early on, because you don't have those pains, you'll be able to activate your quads easier. You'll be able to get your range of motion a little easier. You'll be able to walk a little easier, and you'll be able to get back to everyday living faster than someone that had an autograft. And that's gonna allow for the everyday person, everyday athlete to get back to work easier, get back to school. So it has that pros in that way. It doesn't necessarily mean you're gonna go back to sport faster, but you're just gonna get back on your feet faster than someone that had an autograft. All right, guys, we went over the pros. Now we're gonna go over the cons, and I'm gonna have some rebuttals for you. I'm gonna make you guys a believer. So the first con is the risk for injection/rejection. And that's kind of like the main one. Everyone says like, hey, the reason why you shouldn't do allografts is because you might get infected or it might just reject it. And the reason it gets, that risk for injection/rejection is because it comes from a cadaver. It's not your own bodies. But honestly, that rarely happens. I think last time I saw the studies, it said it was 0.5, so not even 1%, 0.5% of that happening. But there is a chance. But from all my years of experience, I've never heard of it, never seen it, but there is a risk for that. All right, guys, the last con in regards to allografts is that it has a higher re-tear rate than the other grafts. And that is true. However, there's a lot of factors to be associated with that. So when it comes to an allograft, it has the same re-tear rate, I believe, as a hamstring autograft. So the gold standards are always the patellar tendon and the quad tendon, but the allograft has shown previously to have a higher re-tear rate. And the reason I think there's a higher re-tear rate is because, like I mentioned in the pros, you have less pain and people feel better faster and earlier than your other grafts, and they think they can go back to sport faster and earlier than other grafts. And that, I think, plays a role in that. Another thing when it comes to that allograft is that with the re-tear rates, there's also re-tear rates with autografts as well. So it all comes down to your rehab. So the rehab that you're doing is far more important, I would say, than the actual graft itself, allograft or autograft, when it comes to re-tear rates. All right, guys, we're gonna go over the closing thoughts on an allograft. So we went over the pros and cons. First, comment below what you think, what your thoughts on this video. And if you had an allograft, let us know how you're feeling. But I'll give you guys my quick little summary. So like I mentioned, you have to choose between two categories, autograft, allograft. Autograft is great for those younger athletes that are going to return to sport, highly competitive levels, and if they didn't have any other damage besides the ACL. Because sometimes when you have other damages, you might not be able to get the autograft. So for those, I recommend, the quad, patellar tendon. But for those athletes that are a little older, over the age of 27, they're still playing sports and want to get back to working everyday life faster, an allograft's not a bad choice. The rates are very low for that infection/rejection, and it just allows you to get back to everyday living, and you're still able to go into your normal sports and everything as well. But the main theme is, one, you got to start talking to your surgeon, because sometimes your surgeon might say, hey, you're not a good candidate for an autograft, or you're not a good candidate for allograft. So first, find out what their preference is, what their most experience is, and also talking to your physical therapist based on your goals. Let's figure out what graft is best. If you want to learn more about graft choices, check out the description below. We have a great video on that. But the main theme is that the rehab is actually the most important besides the graft, to be honest, because the rehab will set you up for success and won't increase your risk for re-tears. The thing that increases your risk for re-tears is not so much like what graft. Obviously, the graft plays a little minor role, but going back too early. So making the right decisions during rehab, getting your body prepared for sport is going to be the ultimate deciding factor and the biggest investment that I tell people to really work on, as opposed to really stressing too much on the graft types. Really focus on the rehab. But yeah, guys, comment below if you guys have any questions, and if you guys want to work with us in the Southern California area, send us an email. We also work with people online regarding ACL. We are the Basketball Doctors. Let's ball for life.